Good morning, everyone. This is Bill Collins from Infinity Benefit Solutions, and we're going to talk today about the health insurance renewal underwriting process for large groups. And in this case, when we say a large group, we're talking about groups that would have 51 or more employees. So it's a little bit less or a little bit different of a process for small groups. And if you're a group much larger, say over 100 or so, the process is even different again from this. So specifically, this is just talking about that 51 plus, so really like 51 to 100 size group. This is being recorded, and so there won't be any questions today, but the last slide will have my contact information, and then feel free to reach out with any questions that you may have. So what we're going to talk about today really from an agenda standpoint is the renewal timeline. So what's the process of when it begins to when it ends? We'll also talk about block level pricing, which is a process that the underwriters use each month to set the pricing for their various products. And then we'll also talk about risk tiering and how an underwriter would categorize a group into a different tier based on the risk that's present in the group. And then finally, a number of the metrics and key factors that also go into the final renewal. So really explaining, how do they come up with that number that you're getting. So we'll start with the renewal timeline. So typically, and this is really key, the underwriter is going to pull the client's file about 90 to 120 days in advance of the renewal. So the reason that's important is that a lot could occur between then and when we're actually sitting down with the client and making decisions. So for that reason, you'll notice that our conversations when we actually sit down are going to be asking for updates. So what does the employer know about the group? Any conditions that they were aware of? A lot of times the employer is very in tune, especially if the condition relates to an employee rather than a dependent. But we'll ask, has there been any recent terminations of a person who was treated for a serious condition? Any deaths for that matter? Somebody who has been cured, released from care by their attending physician? Somebody who may be just leaving the group in general, or maybe they've gone out on disability. But we're always going to ask for some updates as we get closer because a lot can change in that period of time. And then typically that renewal is going to be released to us about 60 to 75 days prior to the actual renewal. We'll do a little brainstorming with the underwriter, talk about what's on their mind. Sometimes there's a new product or an option that the underwriter is trying to steer us to that they will price aggressively in order to make that attractive. Every so often you'll get a no bid offer where the underwriter says, this is a great group, we really want to keep them. I'm going to come out of the blocks with a very aggressive, attractive offer in order to try to lock this renewal up early. And in absence of that, then we're always going to be considering other carriers as well, shopping the market, seeing if the rate being proposed for that product is within the marketplace or if it's higher, if it's lower, and then making decisions from there. So well in advance then of the renewal effective date, we've met with the client, we've made recommendations, and we've communicated the options to the employees so they can make their open enrollment elections. So beyond that then, talk about the block level pricing. And this is really when the underwriters will sit down and look at the entire block of business that is in that size category renewing that month. And they'll compare the cost of the claims that they're paying to what they were a year ago. And they're going to assign an inflationary factor then to that entire block. And that's what they call the trend. So the inflationary trend for healthcare expenses typically is tracking at a much higher rate than the general economy as a whole. But they start by looking at the overall block before they get down to the more granular level where they're saying, okay, and depending on the carrier, they might have 3 or 4 or even 5 different risk tiers. But generally speaking, let's just say you had 3 tiers. pretty straightforward. An unhealthy group is going to get the higher rate increase. The healthy group would get the lower rate increase, and then a moderate group who's right down the middle is going to be pretty close to whatever that medical inflationary trend is. And so that's really kind of then the starting point where the underwriter begins reviewing the case. And so then we've assigned risk tiers. The underwriter then is saying, here I may have this much room on this particular group because of how they're performing. They've got a little bit more flexibility on a group that's running well than a group that is not running so great. So that's the general first go around, but then there's a lot of other factors that come into play when we try to calculate what the final recommendation is going to be for the renewal. And so those additional factors are going to be medical inflationary trend, which we just discussed. So the underwriter is going to say, okay, are the premiums keeping pace with the cost for paying the claims? But then they're also going to look at, even if a group had a bad year, what's the probability of future claims versus one and done claims? So somebody in the middle of cancer treatment may be projected to have expended ongoing high cost cases, where somebody who's just recovering from a knee replacement is considered more of a one and done. The claim is behind us. So even though it may have been a big hit, they're not going to try to recoup that money going forward. They're going to wait prospectively for the claims that they expect to be in the pipeline going forward. And then they take a look at the group's relationship to the entire rest of the block. And that's really they call it the relationship to manual. So they're saying, if we took all our claims and divided it by the premium, what would be the perfect rate to charge so we cover all of our claims expenses and then have enough left over to cover administration and profit margin? And so they'll look to see, is the group already higher than that or lower than that, or right about where they should be? Demographics also come into play. So age changes, gender changes, those factors also calculate into the renewal rate. And then the loss ratio. So we do get, on groups this size, we will get a premium versus claims. So we know how much money came in premium, how much went out in claims. Generally, the target is the underwriter would like to see 85 cents of every dollar go to pay claims, and then the remaining 15 cents they use for their administrative overhead and margin. And then beyond that, bundling of products. Every once in a while, the underwriter will have an attractive offer for adding additional lines of coverage. So they may want to add dental or vision or life or disability. And then we have to kind of weigh the pros and cons of how much money do we save in medical premium to disrupt those ancillary products. Is it really worth us doing that? Or are our other clients happy with those ancillary products with that medical carrier? So that all goes into the mix. And then finally, this is really kind of more the art versus the science, is the longevity with the carrier. So they do pay attention to how long has this client been with the insurance carrier. There is a high acquisition cost. So underwriting and installing a group and issuing e-cards and building out their system is very expensive. And so the underwriter always keeps in mind, it's a lot less costly for me to figure out a way to keep this client than to have to lose them and then go out and find another one to replace them. So you almost think about it as loyalty rewards, where they do take into account how long you've been with the carrier. And then too, the relationship with the benefit consultant. We try to build relationships with the underwriters so that they trust us when we're negotiating for better cost and the quality of the business that we've brought to them over the years. And that trust factor really does go forward into the benefit that we can bring to a client during the negotiation as well. Because after all, the ultimate goal is that we want to pay as little as possible for the best plan as we possibly can, is always the goal. So all those factors, and over a period of several weeks of time and back and forth and consulting then with the client and what they're trying to accomplish, and to have as little disruption as possible, then hopefully brings us to a mutual agreement that everyone can be happy with. So that is it in a nutshell for how the groups of 51 plus employees are viewed through the underwriting process and what we do on our end. And even though we're not taking questions today, we do welcome if you would have any interest in further discussions or questions on this topic. Please feel free to reach out to me at the phone number or email listed, and we look forward to then working with you on an ongoing basis. And thank you very much for joining this discussion today.